The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, gynecologist Dr. Scott Lauer talks about how the InterStim device can successfully treat urinary incontinence in women. ENT Dr. C.T. Wynn talks about a procedure called balloon sinuplasty. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Learn more about the outstanding medical facility Houston Northwest Medical Center. Oral surgeon Dr. Paul Metz improves his patient's life with dental implants.
I always felt as if I had a bladder infection, and I had been on antibiotics for a long time. You always feel as if you need to go to the restroom, and then when you get there, nothing's happening. There's a lot of abdominal pain. It's hard when you're good for 1 second, and then all of a sudden, you're down for the count.
Jolene's a very interesting case. She presented with pelvic pain and urinary urgency. She had had several laparoscopic procedures. When she came in, she had multiple urinary tract infections, treated by a family doctor, would never get better.
It was kind of unexplainable. You know, I would do all of the things you would do if you got a bladder infection. You know, I would drink water only and this and that. Sometimes it would just last for the day. Sometimes it'd be a couple days, but it would just come and then it would go. You know, other doctors in the past, they would just give me antibiotics. I didn't have a bladder infection.
True urgency is basically when you get the symptoms, I gotta go, I gotta go, I gotta go. The InterStim works by stimulating the nerves from the sacrum that innervate the bladder, and it can act as a amplifier for the signal, or it can act like a reduction. You know, it's getting overstimulating. She stopped the medication on her own, said, what can we do? I told her we could try a trial of the InterStim procedure.
I wore it for a week and it helped. I fell in love with it, and then I decided that, yeah, this is what I need, and then we went back and put a permanent one in.
With her InterStim procedure, Jolene basically is treated or in remission. She's actually doing excellent.
I think it's been right about a year since I've had it. I don't know what was happening inside my body, but that InterStim did it. It fixed it. So for me personally, I mean, it's just made me, I don't have to worry about it. You know, it's just, I feel great. I always feel good. I don't ever have that issue.
Catching a whiff of an aromatic herb like rosemary may increase alertness and improve memory. To stay sharp, try smelling fresh rosemary or inhaling the scent of rosemary essential oil before a test or meeting.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Ready Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. But what they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate, it's a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon two-prong approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, you can actually smell the candle.
Find your doctor on bestdocsnetwork.com.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back at home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
Shonda has a question for Dr. Jerome Nafee. Who is the most susceptible to having bad veins?
Men and women together can have the same types of varicose veins, as well as spider veins and small varicose veins. Women are more prone to have them because of pregnancy is an aggravating factor when they have the underlying inherited condition of varicose and spider veins. When women are pregnant, their uterus can push to one side or the other and compress the vein flow back to the heart. And so that uterus is like a big ball sitting on top of the vein and causing these veins to dilate up.
Ask our doctors on bestdocsnetwork.com.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided,
attention to detail is phenomenal. From the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, reproductive endocrinologist Dr. Robert Kaufman talks about how his fertility practice offers the highest level of multidimensional patient care. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Clinical psychologist Dr. Collins Hodges talks about the therapeutic techniques he uses to help children and adolescents. Neurosurgeon Dr. Jean-Louis Benet discusses the cervical fusion procedure and how it has helped some of his patients overcome neck problems. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care.
At Fort Worth Fertility, what we really want to do is help our couples get pregnant, and we really believe this is the place for them. We can provide them with the best care from an emotional standpoint, from a success standpoint, and we can make you feel like you're in a unique situation here where we'll treat you as an individual and we'll do the very best we can to help you achieve your goal. We look for unique situations for our patients. We try to tailor what their individual needs are. I think the importance between our center and other centers would be we're very upfront with patients. We let them know what their expectations to get pregnant are. We let them know what it's going to take to get pregnant. We know financially what it's going to take for them to get pregnant. In addition, we offer numerous treatments. We offer inseminations where we put sperm inside the womb. We offer in vitro fertilization where we'll put embryos inside the womb. We can offer surgery. We can offer fertility medications. And there's a host of other things we can offer patients at this center, everything under one roof for the convenience of our patients. Our typical first patient appointment is where we'll actually spend probably about an hour talking about things. We'll talk about their history, we'll talk about possible evaluations they may need, and then we'll even start talking about potential treatments. When we talk about treatments, we'll let them know what their chances of getting pregnant are, how much it's going to cost, and what do they need to do. And so we really try to evaluate it thoroughly so we don't miss anything, so we can give them the best options to get pregnant. We're very proud of our egg donation program and surrogacy. We're known internationally for that. So it's not just Fort Worth. You think, oh, we just get doing things in Fort Worth. But we really see patients from all over the United States and all over the globe. And we're honored enough to be able to treat those type of patients here in Fort Worth. The other aspect here at Fort Worth Fertility is our staff. I think we have an outstanding staff, and we all need to work as a team to get the job done. We do know there's a lot entailed in helping our patients get pregnant. But we do try to find a cost-effective means to try to get our patients pregnant and give them our best advice on how to accomplish that.
Request an appointment on bestdocsnetwork.com.
We've all had heartburn. Now, it's kind of odd because it has nothing to do with your heart, but it sure does burn. And what causes it? Usually it's when acid leaks up through that little round muscle that's supposed to be nice and tight and keep acid in the stomach. That acid leaks up into the esophagus. So what makes that happen? What loosens up that little round muscle? Alcohol does it, caffeine, chocolate, cigarette smoke, peppermint, spearmint, tomatoes, that kind of stuff we're all guilty of. So what do? You go out to a restaurant, you have a drink or two, you eat a fatty meal, and then as you leave, you take a peppermint with you. And all of that relaxes that little muscle so the acid can come north. You go to sleep and lie down in bed, and boom, the acid's in your esophagus. That's no fun. It can cause painful burning, even some hoarseness as the acid leaks up and irritates your vocal cords at night. So what can you do? Well, first of all, reduce those things I just spoke about. Secondly, you can get over-the-counter medications. There's two kinds. There's strong stuff and there's weak stuff over the counter. Ask your pharmacist which one might be best for you, or ask your doctor.
Behavioral management is all about changing negative behaviors. My goal is to promote healthy families. We're here to promote healthy relationships. I work with parents to identify specific problematic behaviors. When parents come in and their children have behavioral problems, the first thing we want to do is target any stressors that are going on. And number two, identify what those behaviors are. Once we've identified those, I want to really get together with the parents and see how parents are implementing consequences to those behaviors. For example, we want consequences to be specific, immediate, consistent, and we want them to be meaningful to the child. We want children to feel like they're being recognized and noticed and reinforced for positive behaviors, ideally more often than the negative behaviors. We want children to feel good about their interactions with their parents. And parents want to feel good about their interactions with their children. There's a lot of emphasis I place on establishing trust, really getting down to understanding how the child perceives his or her problems. What is it exactly in his or her world that is giving him or her difficulties? The core of setting up a behavioral management program is setting up a behavioral contract that links wanted behaviors with privileges, and working together as a group to create kind of a scenario in which there's an outline for success, and it's something that can be checked on a weekly basis at home and then in the office. My goal is to promote healthy relationships between parents and their children. It's about kids feeling good about their relationships with their family and their friends. And same thing for the parents. I want them to feel good about the interactions they're having with their kids.
Brushing your teeth can prevent stroke. People suffering from gum disease are twice as likely to have a heart attack or stroke.
Terry has a question for Dr. David Brame. Why is it important to lower my cholesterol?
High cholesterol, along with a positive family history, being a male over 45 or a female over 55, having diabetes, smoking, and high blood pressure are the 6 risk factors for developing heart disease. We can't do anything for a person who has a positive family history. We can't change that risk factor. We can't change someone being 45 or 55. But we can control their blood pressure, their cholesterol, their diabetes, and we can get them to stop smoking. Cholesterol can clog the arteries, which lead to obstruction that provides blood to the heart muscle, to the brain, to the kidneys, every part of your body. It's essential that in people who tend to make more cholesterol than we need, that we control those and keep those levels down.
Ask our doctors on bestdocsnetwork.com.
I actually hurt my neck in a car accident when I was in my 20s, and it's progressively gotten worse. My neck would stiffen up, it would hurt a lot, and I'd put heat on it. I loved to read, and I noticed I couldn't read anymore. So I had an MRI and found out that it was critical. That's when I realized I needed surgery, and as a result, found Dr. Bonet.
When Marilyn came, she obviously was in tremendous pain, so in her situation, we had to move quicker so that we can bring her the comfort that she needed.
My neck seemed to lock up, and it would hurt at times, especially if I'd read or I noticed, trying to turn. When I was driving, it was hard to do that, and it would depend on my activities, but it progressively just got worse through the years till, I just could hardly stand it anymore.
Her occurred from a degenerative process. What that is as the joint starting to age and get degenerated, they can do so in such a way that abnormal tissue builds around this joint, bone spurs builds around this joint, and it causes pressure upon the adjacent nerves. She underwent her surgery uneventfully. We were able to clean up all the bone spurs and the disc tissue that was compressing on the nerve. She did have severe compression of the nerve, particularly at one of the levels as it leaves the spine to go down the arm.
He did a 3-level fusion on my neck. And considering that and my age, I feel great. I feel like I could do cartwheels.
She was able to tolerate the intervention uneventfully. By the time she woke up, she was already able to notice the difference between the pain she was experiencing before and after that.
He is a miracle worker. My neck is totally restored. I feel wonderful. The quality of life just seems a lot better because it don't hurt like I did. I can read. I can turn my neck better. I'm a little more comfortable driving. I had to go through the pain after the surgery, which takes a while to heal, but you know, that wasn't that bad or that long. I feel like I've really turned a corner.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with very complex spine problems. However, not everyone may need spine surgery. So we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.